Evening, everyone. My name is Prolongation. Tonight we have a very special guest, Mr. Charles Van Riper. Hello, Charles.
Hi there, Prolong.
Charles, I know that you are referred to as the father of stuttering modification therapy. Can you tell us more?
Oh, Prolong, did you know I used to stutter? As a result, I developed stuttering modification therapy in the 1930s. In my opinion, stuttering is primarily an avoidance reaction. People who stutter tend to avoid feared words and situations.
That's great that you want to eliminate stuttering. Tell us more.
No. The goal of stuttering modification therapy is not to eliminate stuttering. Instead, we aim to make stuttering less severe and reduce the fear and avoidance of stuttering. In fact, there are 5 goals for a patient receiving stuttering modification therapy. 1. Reducing anxiety and fear. 2. Increasing acceptance of stuttering. 3. Reducing motor tension. 4. Eliminating avoidance behaviors. And 5. Learning new behaviors.
Thank you for clarifying. Let's take a look at some of your goals and real-life examples.
The first goal of stuttering modification therapy is to reduce the anxiety felt by a person who stutters. The second is to have the person who stutters accept their stuttering.
How can I help you?
I would like coo.
Ricky, it's okay. Try again.
I want.
There's nothing to be afraid of. We're all friends here. It might help to tell her why you're having such a hard time.
Take your time, Ricky.
Sorry, I stutter. I want a soda, please.
Soda. Coming right up.
Fears and avoidances related to stuttering are reduced by identifying, studying, and understanding thoughts, feelings, and attitudes about communication.
The last goals of stuttering modification therapy involve altering physical demeanor, avoiding secondary behaviors, and learning new behaviors. Stuttering is a collection of inappropriate learned behaviors involving the lip, tongue, jaw, and other parts of the speech mechanism. People who stutter often hold their mouth in a fixed position as they prepare to make sound.
G.
Vicky, please relax your jaw. Before you speak, prepare yourself. Keep your mouth and jaw in a relaxed and neutral position.
G.
It's okay, Vicky. Let's try again. Remember to relax and think about how your lips, tongue, and jaw move.
G. Good evening, Doris Denby.
Great, Vicky. With these relaxed articulators, easier and more fluent stuttering can be accomplished.
Wow, that was very insightful. A special thanks to Vicky. It must have taken a lot of courage to stutter for us. How long has she been in therapy?
Vicky is a wonderful client. She is on her 2nd week of therapy. The length varies depending on the client. Normally, it takes about 1 week for each step of therapy.
Interesting. Can you go into more detail about how the steps?
Patience. I was just getting to that. There are 6 stages. 1. Motivation. 2. Identification. 3. Desensitization. 4. Variation. 5. Approximation. And 6. Stabilization.
Midvas. Let's take a closer look at examples of midvas.
Jim, a person who stutters, will help me explore the 6 phases of stuttering modification. The first phase is motivation.
During motivation, the clinician should express their role as a companion and share the weight of the stuttering by being positive.
I want pa.
It's okay, Jim. Let's try again.
I want pa.
It's okay. We can do this. I'm here for you. Just relax and try to finish your sentence.
I just want pa.
I know you're having trouble. Tell me how you feel.
I want to order food, but I can't.
It's okay. Take your time. When you get stuck, try to ease out of it. Like this.
Excuse me, waiter. My friend would like some peanuts.
The second phase of stuttering modification therapy is identification.
As a part of identification, the clinician engages the person who stutters in recognizing and evaluating his or her stuttering. Then, they can identify core behaviors, secondary behaviors, and attitudes.
Jim, tell me about your work. If you stutter, just stop and tell me what you notice about your stuttering.
I am a d. I struggled. My face was tense.
Good, you recognized your struggled speech. Now we can correct it to become effortless. Let's try again. This time, try to relax your face. Jim, tell me about your work.
I am a dog walker.
Third in the process is desensitization.
The goal of desensitization is to reduce the speech-related anxieties and negative emotions held by the person that stutters.
It's okay, you've been doing great. Look at the progress you've done.
I'm nervous.
Just relax, you can do it. You've come so far.
Can I have your number?
Sure thing, dear. 5551231. Call me.
I did it, Charles.
See? His morale went up and his fears went down. Bravo.
Next up is variation.
During the variation stage, individuals change how they stutter and their reactions to the stutter. They learn to stutter differently.
Jim, what do you want to eat?
I want a peanut.
I see you struggled. Let's change how you stutter the word peanut. Watch Vivian.
Instead of repeating the p sound, let's stretch the p sound, like peanut.
I want a peanut.
The fifth phase of stuttering modification therapy is approximation.
Through the approximation stage, clinicians introduce new techniques to gradually diminish stuttering. The clients learn strategies to smooth out and minimize stuttering. There are 3 types that fall under the approximation category: cancellations, pullouts, and preparatory sets.
During cancellations, the person stutters all through the word, stops immediately, and then repeats the word stuttering in a different way.
Beaver. Beaver.
During the pullout, the person gains control over the moment of stuttering while it is happening. Then they smooth it out.
Meatball.
In a preparatory set, the person prepares for a moment of stuttering before it happens. Then they start gently and glide through the stutter smoothly.
Okay. 1, 2, 3. Poodle.
Stabilization is the final stage of stuttering modification therapy.
During the stabilization stage, individuals become their own clinicians. They do this by using new stuttering controls in situations of daily life, stuttering voluntarily, or seeking out communication situations previously avoided.
1, 2, 3. Help! I can't find my dogs.
How many dogs are you missing?
9 dogs.
There they are, under the table.
Thank you so much. Can I have your number?
I gave you my number yesterday. You never called me back.
I was too scared to talk on the phone. Not anymore.
Wow, look how much Jim changed. He seems much more confident.
Jim made great progress. He went through an extensive therapy. We met 1 hour for individual therapy and 1 hour for group therapy for 3 days a week over a period of 4 months.
Oh wow, Jim, that's a long time. What happened after you completed Midvis?
Now my sessions are reduced to 1 or 2 times a week for another 3 to 4 months. I am now more aware of my disfluencies and practice self-therapy. I've learned to monitor and anticipate my stuttering, tension, and struggling.
Hey, you in there! Hey,
That
stop!
noise is coming from outside. Let's see what is going on.
Hello, friend. What's going on?
Stuttering modification does not work. There is no evidence to prove its effectiveness.
But look at Jim. It worked for him.
He's still stuttering, isn't he? By teaching him to stutter in a new way, you are assuming that he will always stutter. That is horrendous. Why would you want to increase the stuttering moments? That might lead to the development of secondary behaviors. And, look at how long he was in therapy. It's too extensive.
Oh my. What a riot. Let's see what Charles thinks.
Charles, there's a man that says your therapy is baloney.
I know there is not much empirical evidence to promote its effectiveness, but it's been used over 50 years in schools, hospitals, and clinics with much success. I want to encourage the understanding, acceptance, and improvement of disfluencies. There's nothing wrong with that. As I always say, out of the therapist's faith can come the stutterer's hope.
And that concludes our presentation on stuttering modification therapy. Remember, the goal of stuttering modification therapy is not to eliminate stuttering. Instead, we work to modify the moments of stuttering, reduce the fear of stuttering, and eliminate avoidance behaviors associated with this fear.